You know, I keep telling you guys the same thing over and over again, but some of you just do not listen. Hey guys, welcome back to the Dr. Cliff AUD vlog. This is vlog number 248, and today I want to talk to you about something that's been going on out in the world of hearing loss treatment. But before I do me a huge favor, click the like button, really helps out the channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It is greatly appreciated. So what is prompting this particular video? Well, you guys know that I've been for 7 years now talking about the importance of finding an excellent hearing care professional to treat your hearing loss for you. In fact, the hearing care professional that you work with is significantly more important than the hearing aids that you get, even though the hearing aids do ultimately matter. But I spend a lot of time on hearing loss forums, and I get to see some of the questions that are being asked inside of these forums. So I wanted to go ahead and share with you guys a comment that was put on one of these hearing aid and hearing loss forums on Facebook. And it reads, "Hello everyone. I got new hearing aids from Costco, Philips HearLink. I have Oticon Mini Right that I used before that. The Oticons are real good for speech and also for music. I play piano, and without any setting change, Oticon works and I can hear piano well. HearLink is not that good for piano playing. Costco gave me a program called Hi-Fi Music, but using that too, it doesn't sound good. So I need suggestions on what I can tell Costco Audi, which is an audiologist, to do. Is there a specific setting I should tell them to adjust for hearing piano well? Any help is appreciated. Are there any piano players in this group who had similar issue and got it resolved? Thanks." So, okay, let's break this down here a little bit. So, if you're not familiar, of course, you can get hearing aids at Costco, and one of the brands of hearing aids that you can get are the Philips brand. Now, Philips is actually owned by a company called Demont, who also makes Oticon hearing aids. Now, this particular individual, they have Oticon hearing aids already. Let's see, I think it may be the... let's see what brand. Oticon Mini Right. I don't know essentially which model that was. I presume it's at least 1 or 2 model generations old, but the Oticon brand is something that you get from a hearing care professional who works in an independent clinic or something of that nature. Now, the issue here with this individual is that they're basically making a change going from their independent clinician to a Costco clinician. And they're having difficulty hearing and understanding music very well. And I think that's the only thing. I don't think there's anything with speech understanding here. But nevertheless, the individual had done very well hearing and appreciating music using their old hearing aids, but transitioning into their new hearing aids, they're not doing so well. And they're basically asking for any advice that they can share with their audiologist at Costco. And whether or not it's an audiologist or a hearing instrument specialist doesn't really matter. What's very clear here is that whoever the hearing care professional is at this particular Costco, they're having difficulties making adjustments for this individual so they can hear and understand music well. Now, I do not want this to come across as I'm just Costco bashing here. It just happens to be the comment that I'm posting here, because you could look at comments just like this. Every once in a while, new comments will get posted about like, my hearing care professional is unable to set up these hearing aids correctly for me. Any advice that I can share with my professional? And it's just comical, because that is the job of the professional to know exactly what to do for you. And if they're not able to do that for you, they should be referring you to someone who can do that for you. There are often times where I have a patient come into the clinic and I am not capable of fully satisfying their issue. And so what do? I refer them to a hearing care professional who can solve the problem for them. I feel like that's part of my job, to understand what my limitations are and if I need to refer that person out. Now, in this particular case, hearing and appreciating music, the problem is that the previous hearing care professional that this individual went to clearly had an understanding of how to set up a pair of hearing aids to make it very good for playing piano. Now, new technologies come out, there's new features and adjustments and stuff like that, but reason would have it that you should be able to optimize newer hearing aids even better than the older hearing aids if you know what you're doing. So myself, I've had several professional musicians come into the clinic. I literally have them bring their instruments into the clinic so I can make adjustments on a very particular program for them. So if I'm not able to take their main program because our main focus is understanding speech or understanding speech and background noise, whatever the case case may be, whatever the highest priorities are for that particular individual. I create an alternate program, and then I have the individual play music. And you can either do this live in the office, you can even do it remotely. But what I can say particularly with Oticon hearing aids, that there are certain features that have to be disabled, otherwise it creates some crazy artifact and just distortion, and it just doesn't sound good when someone's actually playing their musical instrument and listening to it with their hearing aids. Now, this is completely different than streaming audio as well. So you might be able to listen to streamed piano music and it sound really good, but anytime that you're playing it live, it sounds like garbage. Now, you would assume that, well, shoot, these newer Philips hearing aids, they're basically made by the same company, so there's probably not a whole lot of differences between the way the Philips hearing aids are processing piano music and the way that his old Oticon hearing aids are processing music. There might be a couple of variations, but ultimately you can defeature these hearing aids as much as you want to as the hearing care professional to make sure that they don't sound like crap when you're trying to listen to music. Because let's face it, most hearing aids are geared towards hearing and understanding speech primarily. In the case of patients, when they come into my office, I'm having them play their musical instrument, and 9 times out of 10, I have to turn off certain digital features because it's introducing artifact into the music that they're playing. But that is neither the case nor the point here. The point is that if you feel like you need to go onto a social media forum and ask other individuals with hearing loss, hey, tell me what to tell my audiologist so he can fix or she can fix the problem, that is a huge issue. I mean, having to actually go and source information from either another professional or from another consumer to teach your provider what to do is completely unacceptable. Now, again, maybe this provider at Costco is in over their head. Maybe they don't really know. I mean, honestly, they probably don't even have a lot of time, and they probably can't tell their patient to bring their musical instrument in with them. But the simple fact that this individual is reaching out, maybe he should reach out to his previous hearing care professional who obviously knew what they were doing when it came to programming the hearing aids that he had, the Oticon hearing aids that he had for music. He would probably have more success reaching out to another professional than he would reaching out to a social media forum. Now, I'm not saying that you guys don't know anything about hearing loss. I'm just saying it just seems silly to me that you're paying someone money to treat your medical issue, which is your hearing, and then them not being able to do it, and you have to try to figure out what the solution is yourself. That is completely unacceptable. I'm a big fan of being an advocate for yourself, but there has to be a line that's drawn when it comes to professional audiologic care. And if you're going to someone and you're getting hearing aids that you've been told are exactly the same hearing aids as what you can get from an independent clinician, it is not the hearing aids that you're paying for when you go to an independent clinician. You're getting their expertise. Now, I will say this. There are some independent clinicians who also do not know what they're doing in some of these cases. So I don't want this to come across again, because I know you guys are going to tell me in the comment section, Cliff, you're just bashing Costco because they sell hearing aids for 1/4 of the price that you sell them in your clinic. Like, I get it, but this happens in independent clinics too. So if you're going to Costco, Sam's Club, an independent clinic, a hospital, the VA, whatever the case may be, if you feel the need to reach out to a social media forum to ask them what to do so you can tell your audiologist to fix the problem, that is a huge red flag, and you should probably find a different place to go. And that's something that I've been trying to get across to you guys for the last 7 years now. It has everything to do with the level of expertise of the hearing care professional you go to, not the hearing aids that you get. The hearing aids matter, the hearing care professional matters more.